when thinking about it. And feel free to share that around with other people. So with that, I will pass it over to you, Jen.
Okay, great. Thanks, Rob, and welcome to our guests. I am going to give a bit of an update, and with that is a little bit more of an introduction. So Rob went over the housekeeping items for the call. So good evening, everyone. Thanks so much for joining us. On the call, as Rob mentioned, we have our two guests. So Andrea Jackson is the Clinical Pharmacy Manager of CareRx Ontario. Andrea has worked for CareRx since 2017 and continues to support retirement and long-term care homes as a clinical pharmacist in the GTA. And Stephanie Okrafka is the clinical pharmacist with CareRx since 2016. Stephanie is the clinical consultant pharmacist for our 3 Grey County homes, as well as several other long-term care and retirement homes in the area. Stephanie lives in Meaford with her husband and 2 daughters. And as Rob said, they're going to give us a presentation a little bit later. So we met last virtually on December 15th. And as always, there have been further updates and directives from the province, the Ministry of Long-Term Care and Public Health. Infection control, staffing, and PPE strategies continue in the homes. And Grey Bruce continues to be following the gray lockdown level for public health strategies as are being followed across the province. As of today, there are no cases of COVID-19 in either residents or staff at any of our 3 homes. The purpose of our call tonight is to provide an update and to reassure you that we're doing everything we can to keep your loved ones safe. And during this call, we will provide updates on the following. So a little bit about communication when we have an indeterminate test result from our surveillance, visiting status during the stay-at-home order, a testing update, and then we'll get to vaccines, and that's where our guest speakers will give us some more information, and then we'll do questions. So we are seeing the provincial numbers of cases continuing to be high across the province. In our immediate Grey Bruce region, we're seeing a consistent number of cases with actively 35 cases in Grey Bruce. We must recognize that there continues to be community spread of the virus, and we must remain vigilant in our strategies to prevent infection. And just a quick overview of, I think we're at 314 days of IPAC strategies and COVID strategies. And those include the active screening for every person who comes in and out of the building. Staff are working in only one facility. We continue with the interval testing for staff and DCPs every 7 days. We're minimizing the movement of staff from home area to home area. All staff and visitors are wearing surgical masks at all times. Plans are in place in all 3 homes to quickly isolate residents if needed, and plans are in place to quickly move into full outbreak protocols if needed. And we continue to monitor PPE supply and report inventory regularly to the province. So on communication, I just wanted to give everyone an update on the use of Clinic Connects for communication when we have indeterminate test results. So over the last 2 weeks, we have had 2 homes in potential outbreak situations. Lee Manor and Rockwood Terrace both had indeterminate results from the surveillance testing. When this happens, we work closely with public health. We quickly implement enhanced protocols. In both homes, residents in a specific home area or floor were impacted, and the biggest change to the resident is moving to tray service for all meals. We retest the individual or individuals whose results were indeterminate. We have the enhanced measures in place while we wait for the results of those tests. Because the home is not in a declared outbreak, the information isn't posted on the public health website, and we don't use the MailChimp newsletter to announce it. What we have been doing is using Clinic Connects to keep the substitute decision maker or power of attorney informed. If the situation occurs where there's a confirmed positive case, then we would use our traditional communication methods. So we would telephone the substitute decision maker, send out the MailChimp, and then we would use Clinic Connects to give updates, and then we would use the MailChimp to let everyone know when the outbreak is declared over. So when we're in that in-between stage where the test result is indeterminate, are the words that the lab uses, then we're not in outbreak, but we're taking extra precautions. And in the spirit of transparency and keeping everyone up to date, we wanted to make sure that we were keeping family members up to date on what was happening in the home. As you all know, as we all know, we have the stay-at-home order in Ontario, and I just wanted to go over quickly what that means to visiting. So we continue to suspend outings and day trips with the exception of medical appointments and by special request. General visits, including window visits, are suspended. And so when things first shifted, and I don't know if that was last week or the week before, we made concerted efforts to be able to continue to support window visits. And then the province sent out clarifying information saying, no, window visits are also suspended during this stay-at-home order. Thankfully, we have our DCP program, and so designated care partners are still able to visit one at a time per resident. There's been lots of information and talk about rapid testing. And so a very brief update on rapid testing. The province has told long-term care that we will be moving to PAM-Bio rapid testing. Having said that, the logistics and details are not clear and not sorted out. So I have been invited to be part of an Ontario Health West working group to support the 232 long-term care homes in the West region. So Ontario Health West has pulled this working group together to help the 232 homes in the West region make this transition. So we're still sorting out the details and the logistics of how the rapid testing works, how we roll it out, how we track it. And there is still not clarity on how it impacts the designated care partners. So we'll keep you posted. And the good news is we're not required to make this transition today or tomorrow or even next week. We're to begin planning and preparing. Our focus, though, is to be on vaccine readiness and having our homes ready to go if a tray of vaccine arrives on our doorstep. So that's where we're putting our focus of our efforts. Resident masking, it came out in the most recent update from the ministry that long-term care homes should be providing education and supporting residents to use surgical masks in common areas. And so all 3 homes have been working with residents, meeting with them, giving them some education, providing them masks. Residents who are able to wear the masks easily, and lots of them are interested in doing that in the social spaces. So if you're a DCP or your DCP is sending pictures home and your person has a mask on, that's why. So vaccine update. It's very exciting news that the vaccine is rolling out. It's exciting, and there's lots of stuff happening and announcements that are happening every day about vaccine availability. And so that is something that continues to evolve. General Hillier has been holding weekly long-term care meetings with all 600 plus long-term care homes in the province. And we were able to participate in the one this week. And so they are trying to keep us up to date as the plans evolve and change with the availability of vaccine and the provincial plan to roll it out. So the goal continues to have all long-term care home residents, staff, and essential caregivers, who we call DCPs, vaccinated in the province by February 15th. The vaccination process is coordinated by each local public health unit, and we are working closely with Grey Bruce Public Health. I am fortunate to be representing all long-term care and congregate settings for Grey Bruce on the Grey Bruce Vaccine Task Force, and the first meeting is tomorrow. Vaccine is arriving in small amounts to Grey Bruce. 2 local homes have already received their vaccine, with 200 residents, staff, and caregivers being vaccinated last week, which is really exciting. We are expecting 1,000 doses next week, and we've not yet heard from public health which homes are next on the list. But while we wait, there's lots that we can be doing, and so the homes are preparing as much as they can. So they each have a spreadsheet and they're gathering consents, so providing information and education. We're offering Q&As like today for family members as well as residents and our staff. So overall, we've been collecting consents and making our lists for just over a week. And across all 3 homes, we already have 42% of our staff signed up to receive the vaccine. And so that's really promising. And we're working to make sure that our staff and our residents and our DCPs have all the information they need. And so here we are. I'm happy to pass the call over to Stephanie and Andrea. They have some few slides that they're going to show, and then we'll do Q&A.
Thanks, Jennifer. Thanks for having us on the call tonight, and thank you to everyone for taking the time to join us. Our goal for tonight's presentation is to provide you with a fairly quick, brief overview of the COVID-19 vaccines, and this information that we're going to provide is based on the best current scientific evidence that we have right now. Things are always changing, so we're going on what we know as of today. This has definitely been a whirlwind year. There's lots of information coming at us all the time. That can be a little bit overwhelming, and understandably there's lots of concerns and questions out there, hesitancy when it comes to the vaccines. So our hope is to address some of these concerns and questions and dispel maybe some of the myths that are out there circulating. Andrea and I are by no means experts when it comes to the vaccine, so there may be some questions that we may not have the answer to, but we will definitely do our best to get those answers to you. So we'll get rolling. So the first thing I want to do is just give a quick overview of the vaccines themselves. So as you know, there's 2 vaccines currently approved in Canada, the Pfizer vaccine and the Mrna vaccine. So just a quick comparison between the 2. Pfizer was approved December 9th, Mrna approved December 23rd. They're both mRNA vaccines, and we'll talk about that a little bit in more detail in further slides. They both require 2 doses. Pfizer's 21 days apart and Mrna's 28 days apart. Pfizer's requires to be stored at ultra low temperatures, so -70 to -80 degrees Celsius. Mrna at -20 degrees Celsius. So with the Pfizer vaccine, this has posed makes it a little bit more challenging when it comes to storage and transportation. Neither vaccine contains preservative, and as far as how well they work, they're both very similar. They've been shown to be up to 25% effective in the clinical trials that have been conducted. So one of the sort of myths or common concerns I hear surrounding the vaccines is that they were developed too fast. And I agree that they were developed fast compared to what we would normally see when it comes to vaccine development. But we have to remember that we're not in normal times. We're in a global pandemic, and we're in a race against time. So everything was done to speed up this process, but keep things safe along the way. So what was done to make it a little bit faster was all of a sudden we had global funding, and usually that's a big roadblock for research and development is getting the funding that you need to do the research. So when we brought all the global funds together, we were actually able to conduct large, well-run trials. So typically when it comes to vaccine development, we would see about between 6,000 and 8,000 people in the trials, in the clinical trials. When it comes to these vaccines, with the Pfizer vaccine, they had 45,000 people enrolled, and with the Mrna vaccine, we had 30,000 people enrolled. So we actually had big numbers compared to what we usually would see. Another reason that it went a little faster than what we would typically see is that normally with research and development, the stages of the vaccine development happen in phases, and there's often big gaps in between these phases, depending on funding or roadblocks along the way. When it comes to the COVID vaccines, they were able to run some of these phases in parallel while still maintaining all the safety precautions along the way. For example, they were able to start building the manufacturing plants before the vaccine was even available, knowing that it was going to be coming. So they kind of went ahead and started those things a little bit faster than they normally would. mRNA vaccines also tend to be a little bit faster to make than traditional vaccines as well. And Health Canada worked around the clock 24/7 to review the data and the approval process while maintaining all of their strict safety checkpoints as well. So as of January, there was actually more than 15 million people who have been vaccinated worldwide, and no serious safety concerns have been identified. So I'm just going to go over how the mRNA vaccines work and just give you a general overview of this technology. So basically the mRNA is made up of just that, mRNA, which is a messenger RNA sequence, which is genetic message basically. And what this genetic message does is it codes for a certain type of protein. So it enters the body, tells your body to make a certain type of protein. In this case, it is coded to make the spike protein that we see on the coronavirus. And this spike protein is what is used to enter the cells in our body. So it's the spike protein that it codes for. So the mRNA sequence is wrapped in a lipid coating, and that is to be able to transport it into the cells to get it where it needs to go. So once it's in our body, it gets into the cells. The mRNA codes for the protein, the spike protein that's on the coronavirus. And then this causes an immune response in the body that is able to, your body creates antibodies and memory cells so that in the future, it's able to fight off coronavirus should it see it again in your body. Some concerns surrounding this technology. One thing is people are concerned that it is a brand new technology. And the answer to this is sort of yes and no. So it is, yes, it is a new technology, but it's not brand new. It has been studied for over 30 years, but yes, these are the first mRNA vaccines brought to the market. So researchers have actually been studying and using mRNA technology for flu, Zika, rabies, and cancer research, but this is the first mRNA vaccine that has been brought to the market. It's important to know that you cannot get COVID-19 from the vaccine. There is no actual live virus or killed off virus in the vaccine. It's strictly that mRNA code that tells your body to make the protein, and it's the spike protein, it's not the virus itself. mRNA vaccines can change your DNA. That's another common concern or myth that has come up. And this is not true. It's a one-way road when it comes to the mRNA. So with the mRNA, it cannot be converted back into DNA. It does not affect your DNA at all. It's strictly a message that your body reads. And then our body actually has enzymes that break down and get rid of the mRNA soon after. So your body will actually clear the vaccine, but your antibodies and your immune response will remain. All right, next slide. So let's talk about vaccine ingredients. So the mRNA vaccines, the two that we currently have available, have similar ingredients in them. The main ingredients are, so one of the concerns is that they contain dangerous ingredients. This is not true, and it's actually, they contain very few ingredients and fairly simple ingredients. So what is in them? The mRNA, as discussed, that messenger that tells the body to create the spike protein, and the fatty lipid layer coating to protect the mRNA, polyethylene glycol, which is part of that fatty lipid layer, and then a combination of salts, sugar, and water. Okay, the salts are used to stabilize the pH of the vaccine, and the sugars keep the particles in the vaccine from sticking when frozen. So the vaccines are actually free of preservatives, blood products, fetal cells, egg, mercury, formaldehyde, and these are often ingredients that we can find in other vaccines that have been ingredients of concern for some people in previously. that, you know, sometimes haven't had the best rap as far as the media goes. These ingredients are not contained in these vaccines. Polyethylene glycol is something that you may have heard about. There is some thought that that ingredient is a cause of some of the allergic reactions that have been seen, although they have been very few. There is a thought that if you have an allergy to the polyethylene glycol, that you should not get the COVID vaccine. Polyethylene glycol is actually very, very common, and we run into it in probably a daily basis. So it's in things such as medications, in particular laxatives are very commonly contain polyethylene glycol. Cosmetics, toothpaste, contact lens solution, and some food and drinks. And these things do not have not been shown to cause allergic reactions. So they're still researching and looking into that. But if you do have a known allergy to polyethylene glycol, you would be recommended to not get the vaccine. And then, like I mentioned, it's not known that it causes any allergic reaction from food or drinks when the polyethylene glycol is found in that. So it is a common thing that we run into very often. Okay, next slide. So let's talk about what does the 95% efficacy mean. So we talk about that it's 95% efficacious, effective. So what exactly is that telling us? So that means it provides up to 95% protection against clinical disease. And what does that mean? That means getting sick. And so that's what we're most concerned about, is that it's great that it's helping us to not get sick from the virus, but what is still unclear and what's still being studied is we're trying to determine whether it prevents asymptomatic infection, meaning that you could still actually get coronavirus and test positive for it, but you wouldn't be showing any symptoms. And we also don't know the answer to how it affects asymptomatic transmission. So there is a chance that you could still be transmitting the virus when you've had the vaccine, even though you don't have any symptoms. And because of this, and because we don't know the answer to this yet, it's still being studied. That's why we have to keep those public health measures in place to protect everyone until more of the population gets vaccinated. So we need to continue to wear our masks, social distance, wash our hands until we know more about how this works as far as the asymptomatic transmission, and until we get enough of the population vaccinated. There's also been a good question about whether you would still have to have surveillance testing done if you've had your vaccine. And the answer to that at this point would still be yes. The reason for that is the vaccine is not 100% effective, and also because of this unknown asymptomatic transmission, that we could still be spreading the virus even with the vaccine and not know it because we wouldn't have the symptoms. So the big two questions that remain that are still being looked at and tested and researched is, does it protect you from being infected with the vaccine and not having symptoms? And does it protect you from transmitting it to others if you are infected? And next slide. And then I think Andrea is going to take over from here.
Thank you. So a common question that we get is, what are the side effects of the vaccine, and what's the difference between side effects and a severe allergic reaction? So for both the Pfizer and the Mrna vaccines, from the clinical trials and ongoing studies, it indicates that there are no serious side effects found to date. And all of the adverse events that have been reported in Canada are what has been seen in the clinical trials and exactly in the rates that were seen in the clinical trials. So as with other vaccines, some people can develop mild side effects in the days following immunization. And these side effects generally are not serious and go away on their own. So the side effects that we see with both COVID-19 vaccinations that we have available, it's really similar to what you would expect with another vaccine. So pain at the injection site, redness and swelling, tiredness, headache, muscle or joint pain, chills, a mild fever, and possibly swollen glands. What these side effects could actually be thought of is the expected immune response instead of a side effect, as they actually indicate that your immune system is working and responding to the vaccine to produce protection for you against COVID-19. The side effects may be more likely to occur after the second dose of COVID-19. In comparison to these kind of common and expected side effects, severe allergic reactions are rare. And what you may experience if you were having a severe allergic reaction may be hives, which are itchy bumps on the skin, facial swelling, and difficulty breathing. But again, severe allergic reactions are very rare, and all of the vaccination clinics, they come prepared with an anaphylaxis kit in the case that a severe allergic reaction does occur. So for the COVID-19 vaccines, another common question that we get are who can get the vaccine, who cannot get the vaccine? Should I be concerned? Do I have a condition that prevents me from getting the COVID-19 vaccine? So for the two COVID-19 vaccines that we have available, there are only two contraindications, which are categories where these individuals should not receive the vaccine. So if you had a history of anaphylaxis or a severe allergic reaction after an administration of a COVID-19 vaccine dose, or if you have a severe allergic reaction to any component of the vaccine or its packaging. So these are the only two categories where these individuals should not receive the COVID-19 vaccine. We also seem to get a lot of questions about people who are on anticoagulants, which are also known as blood thinners, or if they're immunosuppressed, if they should receive the COVID-19 vaccine. So for individuals on anticoagulants, they may be safely immunized with the vaccine without any discontinuation or disruption of their anticoagulation therapy. It's just recommended for these individuals that 3 to 5 minutes after receiving the injection, gentle pressure is applied at the injection site, and this is really just to reduce the risk of bruising. For individuals that are considered immunosuppressed, either through condition or treatment, individuals who are immunosuppressed weren't included in the clinical trials of the current COVID-19 vaccines. So for these groups of individuals, the efficacy and safety has not been studied in the clinical trials. However, based on expert opinion, vaccination is generally felt to be a good idea in these individuals to reduce the risk of getting a COVID-19 infection. Oops. All right. So along the lines of, I guess, relating to some of the topics that Stephanie discussed earlier, a common concern that we hear among people is that there's not enough long-term data. We don't know that these COVID-19 vaccines are safe, until we get more long-term data on them. What we do know is that millions of people have been vaccinated with these two vaccines to date. And the clinical trials showed us that the vaccines are very safe, and most serious side effects for all vaccines occur within the first 6 weeks of vaccination. After this, the vaccine and the initial immune system response is complete. So for both of these vaccines, we have over 6 months of data and ongoing safety data. So we know that these vaccines are safe, and even from the data from all of the vaccine clinics occurring across Canada, we see that the adverse effects that are occurring among the population are what was also seen in the clinical trials. What we do need to know in terms of long-term data is how long these vaccines protect us against COVID-19. So we need to see just the duration that our immune system provides us protection against COVID-19. We don't yet know if it may be something like an annual booster shot or every 10 years. So this is really the long-term data that we need for these vaccines. So one of the things you may be seeing in the news is there's new strains of COVID-19. The two ones that come up are the UK strain and the South Africa strain. These two strains have certain mutations and appear to be more transmissible. However, there's no evidence that these cause more severe illness or higher mortality than the original COVID-19. And it's thought that our COVID-19 vaccines that we currently have available, they appear to be effective against these new strains, just based on how our immune system develops antibodies to those target proteins. So herd immunity is something you may see in articles about vaccines or hear on the news. So we thought we would just cover what herd immunity is in this presentation. So herd immunity, or population immunity, it may be referred to. It's indirect protection from an infectious disease that happens when a population is immune either through vaccination or developed through previous infection. Vaccination is always the best option because it doesn't result in unnecessary cases or deaths. And vaccinated people, they protect themselves from getting the disease, but also help protect others around them because they're not being part of the chain of transmission. So the proportion of the population that must be vaccinated against COVID-19 to begin inducing herd immunity is still being studied. It's thought it may be between 70 to 90% of the population, but this is an ongoing area of study. So really achieving herd immunity with safe and effective vaccines makes diseases rarer and helps to save lives. You probably have also seen in the news about a delayed second dose of the COVID-19 vaccines. So efforts should be made to vaccinate according to the recommended schedule. So for the Pfizer vaccine, the 2 doses are spaced out 21 days, and the Mrna vaccine is spaced out 28 days between those 2 doses. In general, interruption of a vaccine series resulting in greater than recommended interval between the 2 doses, or however many doses in the vaccine series, doesn't require restarting of the series. In the Pfizer clinical trial, participants received their second dose between 19 and 42 days after the first dose. And in the Mrna trial, participants received the second dose between 21 to 42 days after the first dose. So what Health Canada's regulatory body on immunizations, which is known as NACI, what they recommend is considering vaccine delivery logistics, the second dose of COVID-19 vaccination should be received within 42 days of that first dose. And really, why is the second dose needed? It's because the first dose, it primes your immune system just to start recognizing that COVID protein that it needs to respond to if there's an infection. The second dose really is what helps produce the longer term protective immune response. So it is important to get both doses of the COVID-19 vaccine series. So thank you all. Thanks so much for listening. And we were happy to share the knowledge that we do have for the COVID-19 vaccines. And we look forward to any questions that you might have.
Thank you both so much. It's an excellent presentation, and this same presentation is being offered to all staff on a general staff meeting tomorrow, and we're recording it and making that available to all of our team members as well. So thank you for very calmly and clearly outlining a lot of our questions, and I'll pass it over to Rob to coordinate the question and answer.
All right, yes, thank you, Jen, and thank you for that presentation. That was great. I learned a lot, and I sit on the Grey County Emergency Control Group, so it was nice to get that detailed explanation of vaccines and how that is going to be working. So we do have a few questions already in there. If you are on the call, please feel free to enter them in the Q&A feature there. My apologies to the people that are calling in. I see we do have a few on the phone. We won't be able to take live audio questions from you. But if you do have any, you can also email them to communications@grey.ca, and we will get a response to you as fast as we can. So the first question here, and this one I think would maybe be to you, Jen. With loved ones' annual care conference, why are all immediate family members not invited? So we'd be looking.
Okay, thanks, Rob. I saw that question. I had a chance to look at that in the chat or in the Q&A. So we call and arrange the care conference with the primary contact or the substitute decision maker, but we do encourage that invitation to be shared. And so residents or the power of attorney can invite whoever they like to the care conference. And we've shifted to doing a lot of our care conferences virtually, so that actually makes it easier for people that don't live locally to participate in that care conference.
Okay, thank you. Are there any interactions between the COVID-19 vaccine and the flu vaccine? That would be to Stephanie or Andrea.
I can take that one. So there isn't any interactions between the COVID vaccine and the flu vaccine. And the only vaccine that I have heard a little bit about spacing apart from the COVID vaccine would be if you've received a dose of the shingles vaccine. And that is just to be sort of err on the side of precaution, that you would space those out by about 28 days, but no concerns with the flu shot that I'm aware of. Andrea, if you have anything different.
Yep, no, along the same lines as you, I think what NACI is recommending is just to ensure the full response from the COVID-19 vaccine. If you are receiving another vaccine, after that second dose of the COVID-19 vaccine, you wait 28 days before receiving any other type of vaccine. If you have just received a vaccine, such as the flu shot or maybe your tetanus booster, they just recommend you wait 14 days before starting your COVID-19 vaccine series. And again, it's just to ensure full immune response to the COVID-19 vaccine.
Thank you very much.
I think the other reason to space them out as well would be if there is any side effects or immune response, that you can determine what caused it, because we are really trying to track anything of concern when people have their doses. So it's just to be able to decipher between those, what's causing what.
Right, that would be important, wouldn't it? Is there any chance that a vaccination could result in a positive test for COVID-19? And this is coming from Henry, and I think this would be probably out of concern of impacting their ability to go into the home and visit.
So I guess I can take this. So it wouldn't cause a positive test. So like Stephanie mentioned in the slides, the mRNA, it's really just coding for giving the instructions for making one of the proteins of the COVID-19 virus. So there is actually no active virus, it's really just that one protein that is being coded for with the mRNA. So it wouldn't cause a positive test, thank goodness.
Great, thank you. Are there consents required for residents or families of residents to complete in order to be vaccinated, Jen?
Yeah, thanks. And I noticed there's a couple of questions similar to the consent question, that one. So there is a consent form, and it's developed by the Ministry of Health. And so we're all using the same consent form. So if you are a DCP and you're in doing your swab, there's some information packages and consent forms available there. So that can happen when you're doing your swab. And then we're also reaching out to the resident substitute decision makers or power of attorneys. And so if possible, we're getting signed consent. And if that's not possible because of distance or other barriers to getting a signature, then we can take verbal consent and we document that in our charting documents.
Thank you. What makes Pfizer and Moderna different regarding the 21 to 28 day second doses? Why wouldn't they be the same? Do you have any insight on that?
So a good question. That it's really just based on the intervals they set in the clinical trials. I don't have other kind of insight into why one chose 3 weeks and one chose 4 weeks.
And I think because that's what they chose for the trials, you have to have something, but we are seeing that those schedules can be a little bit more flexible. And so I think that's speaking to the fact that it doesn't necessarily, those are the recommended timelines because that's what was studied. But we may find out more information that the timelines can be a little bit more flexible.
Thank you. How long after receiving the vaccine is maximum immunity achieved?
The recommendation is 2 weeks after the second dose to achieve your full immunity. So they do figure that after your first dose, you do have some immunity. We don't know the exact answer to this as far as how effective it is at that point. But it definitely provides some protection. As Andrea mentioned, we just don't know the extent to that protection or for how long that lasts. So the full 2-dose series is recommended to give you that maximum protection. And it would be 2 weeks after the second dose.
Thank you. Is the COVID vaccine expected to be a one-time in 2 doses deal, or is it expected to be like the flu shot and taken annually?
So I think that's one of the questions that we're all hoping to get answered. We're still studying just how long the average immunity lasts in an individual. So definitely this is one of the areas that we're expected to have more information on. So for now, all we know is that we received the 2 doses and we'll have probably more information hopefully soon if how often we may need to get the vaccine.
As a DCP, do I need to get my vaccine in Grey County, or can I do it in my own region, Hamilton in this example, Jen?
Yeah, so what we believe today, and the rollout for vaccine and long-term care has shifted a couple of times, the way that it was going to be rolled out. So what we understand today is that it would be everybody at the home at one time. So the vaccine would roll in and we would figure out the logistics to get people safely to the site to have their to Grey Gables or Lee Manor or Rockwood Terrace to have their vaccine. So you would be on our list, registered with whichever home you're linked with, and we send that to our public health unit and they count you on the Grey Bruce list. So for right now, for this initial rollout, that's how it would be. I look forward to the day where we have more vaccine in Ontario and Canada than we have people looking to be vaccinated. And I'm confident that that day will come. These stressful weeks right now will hopefully be a distant memory. And so when that happens, then I think there'll be more flexibility for new DCPs and new residents in having some flexibility around vaccination. But for right now, in the early stages, it would be on site at the home that you're linked with. And we would need to be we wouldn't necessarily have a lot of notice. So we might have 24 hours notice, we might have 48 hours notice, we might have a week. Right now, it's just going day by day.
So maybe just getting away from a couple of vaccination questions here that I see. What is the rationale for DCPs going in separately? Visits are still occurring, but separately.
Yeah, and so that's a part of the ministry directive for the visiting guidelines with the stay-at-home order. And while I haven't heard them explain the rationale, I believe it has to do with kind of crowd control and just helping us manage the number of people coming in and out of the home at any one time. And you know, it allows us to make sure we have our good screening processes in place. We don't have too many people you know, in one bedroom with a resident. And so it helps just support all of the things. It helps support the visiting and having someone being able to come in the home, and the distancing and the masking and the testing and the scheduling of the, you know, all of that stuff.
Mm-hmm. As residents' visits are now severely restricted, and residents are also somewhat isolated from one another, what additional health measures have been put into place to maintain mental health? Yeah,
so the program teams and all the staff have always been very aware that they are, aside from the DCP visits, they are the constant human connection with that the residents have on a day-to-day and moment-to-moment basis. And so they know that, and they believe in how important that is. So, and then there's lots of other things going on. So I got updates from the program teams, and they're still doing and planning activities and events in COVID land. So Chinese New Year celebrations, one-to-one visits, enhanced social workers. So the social worker hours are available at the home, and the social worker is keeping up to date on residents' needs. And then I think that there was also lots of opportunities for family members to bring in different devices over Christmas. I think that happened a lot, and people were helping. As their DCP, they were helping their resident connect with other family members that aren't their DCP. And so I know that's happening, and there's been work on Wi-Fi in a couple of the buildings to try to support that. And the homes have also increased the number of virtual visits bookings that are available. And having said that, all of the efforts that have been in place for 314 days, we feel very lucky that we haven't had any significant outbreaks, but we know that that's because of hard work. And we know that we have to keep that level of vigilance up, and that we're not out of the woods yet. And so it's balancing all the safety measures and making sure everyone's getting the everyday activities of daily living care, as well as the social aspects. And so if anyone has any suggestions, we're open to suggestions as well.
Perfect. Are our employees in long-term care mandated to get the vaccine?
Okay, so it is not mandatory. The province has, and this question is asked on the calls with General Hillier and the Minister of Long-Term Care. And so the province has not made it mandatory. We have asked for direction on what happens if a staff member refuses or is not able to get the COVID vaccine. What is the outcome of that? And they're getting back to us. We don't have that information right now.
Okay, well, thank you for that. Which vaccine is being given to Grey County long-term care residents, Pfizer or Moderna?
So the 200 doses that came in last week were Pfizer, I think. Yes, they were Pfizer. And the doses that we're expecting next week are Pfizer. But we're prepared for either. And I think public health will take what we can get, and we'll get it into people's arms.
All right, thank you. So this question says, it was on the noon news today, concern for the fragile elderly as to whether they should or should not receive the vaccination. The deaths are still being reviewed. However, the news reported the concern has risen following 23 senior deaths following vaccination. Stephanie or Andrea, do you have any insight into that?
I don't have any particulars on that. I did see that news story as well, that they're still looking into that situation and those deaths, and researching, kind of looking what went on. So there isn't an answer to that at this point. But I do think that we have to always do a risk-benefit analysis, and that we have to remember that this population is also very, very vulnerable if they get infected with COVID-19 as well. So we have to be very mindful of that, any of the risks associated with the vaccine, the benefit of having it to protect against COVID-19 infection may outweigh that. So, but it is something that's definitely being looked at.
Thank you. And then there's another one kind of related to that, and I don't know if we'll be able to answer this, and maybe you will know, Jen. If a resident has just been sick, is there any time to wait before having the vaccine? Can it be delayed a week or two for what is arranged right now?
So we won't have the opportunity to delay. We'll win the lottery of the next home in line, and we'll be ready to go. And I shouldn't say that, it isn't a lottery. The public health team is working really hard with a priority matrix to determine which homes are most at risk. And it's a very tough decision to make. Not having enough vaccine is a really tough decision. So we won't have that option. However, I'm interested in either of the pharmacists' thoughts on whether there should be a time delay if someone has been sick.
My understanding is NACI's recommendation is to wait until all symptoms of an acute illness. So I don't think we're talking about, a runny nose or a little minor cough, but if you have a fever and you're quite ill, then you would wait until that's completely resolved before vaccinating. So I don't have an exact timeline, but waiting until those symptoms are resolved. And I think that would be to ensure that you get maximum benefit from the vaccine, and also to, once again, be able to determine symptoms of the vaccine after you've had your dose, versus if you were ill, you wouldn't be able to determine between the two. So just ensuring that those symptoms have resolved.
Thank you. Jen, do we have any direction as to whether DCPs will still be required to be tested after they get vaccinated?
Yeah, what I've heard so far is that we will all need to continue being tested for a period of time while the research and the testing on the vaccine, whether it protects us from transmitting the disease, we're going to have to continue to be tested for a period of time. I think we should all just embrace the testing for the next 6 months. And then if it's sooner than that, it's a gift. And if it's not, then we are prepared for that. I'm hopeful that we can get to a place where we're doing rapid testing that is less invasive. I'm also getting my COVID swab nasopharyngeal every week. And so I can appreciate that a nasal swab, just a nice little nasal swab, would be a lot easier. Whoever thought that we'd be saying those words out loud, but that a nasal swab sounds and a throat swab sounds more appealing. But yeah, we're going to have to keep being tested for a while.
And the next one does kind of tie into this, and I think it was touched on. But after receiving both doses of the vaccine, can you still carry or transfer COVID?
Yes, so I think we've answered that one somewhat, that yes, you can still be carrying it and transmitting it. That's what's still being studied, because we just don't know the answer for sure. And so we have to still stay vigilant even after we've had our vaccine, and keep following those public health measures to keep everyone safe.
Perfect. Jen, there's a couple questions here. I'm a DCP who lives 2 hours away. Would you be emailing consent forms to get the vaccine?
I don't think we can email them, but what we can do is, like, this is a rapid process, so we can be a little bit flexible. So we have, each home has spreadsheets, and we're doing our own tracking and keeping track of the information that we know public health needs to be able to do the clinic. So we'll gather everything that we can virtually, so by email or phone, all of your details. And then if we need to, on the day of, you can sign your vaccine when you, or your consent when you arrive. So we're going to just do our best to work our way through it with as much information as we can.
Great. And I think you touched on this. Do you have any idea how much notice will be given when the home is being vaccinated?
No, we don't. The public health team is working really hard with the information they have, and they don't have a lot of information yet either. There's a lot of moving parts provincially, and we've all seen that in the media. And so they've committed, and we meet every 2 weeks and more if we need to. So they've committed to keeping us as up to date as possible. And then my commitment to you is to keep you as up to date as possible. So whenever I have more information, I'll pass it on.
Thank you. So we are at 8 o'clock here. We have about 7 more questions. I don't know what your availability is to stay on for a few more, Stephanie and Andrea and Jen. Is that okay to keep going? Perfect.
Yep.
Okay, so this one says, is washing nose and face with warm or hot water twice a day a good way to help prevent COVID, etc.? The nose area collects bacteria. I don't know if anyone can take that one on.
I am not a nurse, and so I only make up nursey words, and the nurses jump in to save me. So I don't know if Stephanie or Andrea, if you have any.
There's nothing that I know of that has proven that. I think hand hygiene is the most important, and not touching your face and your nose so that you're not transmitting any virus into that area, and wearing your mask when you're out and not able to social distance properly are the things that have been proven to reduce transmission of infection.
Yeah, thanks for that.
Yeah, that's great. And I think soap is a key element in there as well in fighting the virus. So Ian is asking, I get tested at the hospital as I'm able to choose my schedule. Should I be getting tested at the home now in order to get on the list?
No, if you're a DCP that's visiting regularly, we will be reaching out to you. If you feel like we haven't, then give your contact at the home a call, and we'll get your name on the list.
Okay, thank you. Are haircuts and foot care still happening right now in the homes, Jen?
Yes, I think they are. Haven't heard that they're not. So let's go on to another question, and my phone a friend will. So hair, there's no hair happening in the salon. Okay, so no hair care right now from 2 out of the 3 homes. So that I will get more information on that.
Okay, and we'll maybe put that in the follow-up that goes out tomorrow.
Yeah, we can do that.
So this one is specifically to you as Stephanie and Andrea, and I'm not sure if you know the question, but why does CareRx charge my mother a $5 a month specialty service fee when there are no medication prescriptions? And I don't know if anyone can tackle that. I'm not sure in my role.
Andrea, I don't know if you want to touch on that, but I'm happy to take contact information and speak one-on-one to that as well, if that's easier. But I don't, Andrea, if you have anything to.
I think that's a good plan. Take it offline and discuss one-on-one.
Yeah, individual.
I'm happy to do that. Rob, if you want to pass that along to me.
Yeah, Kathy, if you want to email communications@gray.ca or reply to one of the newsletters that go out, I'll make sure that I get you connected with them. Are POAs required to sign a consent for their relative, Jen?
Yes, they are. And so we'll be, the team will be connecting with power of attorneys about what that process looks like. And the update on hair care is that hair is connected to the personal care service lockdown. That's part of the stay-at-home order for essential things only. And so there was a blanket approach across the entire province. And so all hair care services have stopped.
All right. Is there a test to see if the vaccine is working in your body, especially if your second shot is delayed?
So I'm not aware of a test that they're doing to actually see if your body is having an immune response. Like we mentioned, it's within 14 days of that second dose that you're receiving the full protection from the vaccine. And what's the recommendation put out by NACI is that, you know, as long as those doses are within 42 days, that second dose is within 42 days of the first dose. This is within what was in the clinical trials. So it's thought that it should have the same immune response.
Thank you. So Jen, this question is just simply, are all residents being vaccinated?
All residents who are able to be vaccinated and have consent are being vaccinated. And I don't have the numbers off the top of my head, but the uptake for flu vaccine in residents is always quite high. And it is leaning in that direction for COVID as well.
Great. So after we do this round and vaccines have been administered to all current residents, how are we going to deal with new residents that are coming into the home when we have new admissions? Will they have an opportunity to get the vaccine as well?
So that's an excellent question. And we have posed that to, we and many of our colleagues across the province have posed that question to General Hillier on Monday, and they are taking that back and are going to be providing an update for us. But the goal, we do that with flu vaccine. So if someone moves in, in a perfect world where there is availability of vaccine, when someone moves in and they haven't had their flu vaccine and they are able to and they consent to it, we, the clinical team gives that new resident the flu vaccine. So it would go the same way once there's availability of vaccine.
All right. For you, Jen, can the tuck shop be open more than once a week? The residents could use more treats. I think we could all use more treats, right?
I think we could. The other day I noticed that I was out of chocolate, and that seemed like a terrible thing. I will take that back to the team.
All right, perfect. And then again, just one more here about notice for vaccines for people that are working. I think we've touched on that. Unfortunately, we don't know how much timeline we're going to have there.
And we'll do our best. And part of the tracking of information is getting people's contact information. So it won't just be a general email out to the DCPs saying tomorrow's the day, and if you miss the email, you're out of luck. Like, we'll do our best.
Mm-hmm.
And the other thing that I just want to caution is we're hearing in the media that availability of Pfizer is more limited than we were expecting. And General Hilliard did tell us that on Monday, that they were expecting 80% less vaccine arriving in Ontario next week and 50% less the week after that, and so on. But then today, that seems to have shifted again. And so what we're doing is trying to have our lists ready and have everything, the numbers ready, and preparing our public health to know how many people want the vaccine so that they can then advocate for that and help roll that out. But whether or not we'll get 1,000 doses every week or every couple of weeks consistently, we don't know that yet. So it may be some time.
Mm-hmm. Well, we'll certainly hope that those supply lines keep flowing a little bit faster here moving forward. I think that seems to wrap up all of the questions we have here. Again, if you think of anything else that we didn't answer, certainly email communications@grey.ca or reply to one of those newsletters, and we'll get back to you as soon as we can. And we'll probably put it on Jen's update for the next one too, just so that we get everything out there. Did anyone have anything else that you wanted to add here before we wrap it up for this evening?
I just put a YouTube link in the chat box, and I have no connection with this family. It's the Marsh family. I hope that's what I copied and pasted in there. It's the Marsh family from the UK. I know I didn't check with the communications guy before I did this. And they're singing their version of Hallelujah, and it's a COVID vaccine, get your vaccine, and it's super adorable and worth watching to the end. One of the lines is, sometimes we get to be part of something greater, and I feel like we are part of something greater right now, and we just need to be patient and all work together, and we'll get there. So it's worth a watch. And they're wearing cute onesie pajamas. So
great, thanks, Jen.
Stephanie, thank you to our speakers as well. I just want to really thank you. It was short notice, and I really appreciate all of your expertise and knowledge and answering everybody's questions. Thank you so much for being a great partner.
Thanks for having us, and thanks for all the great questions that came in there. That was excellent.
Absolutely. All right. Well, thank you very much, everyone, for tuning in tonight or whenever it is that you're watching this recording. I hope you have a great evening, and we will see you at the next update. Take care.
Thank you. Take care.
Bye.